Imagine a family draining their life savings, pouring every last dollar into a single injection they've been told is a miracle, a revolutionary treatment for their child's autism, a chance to unlock a future they've only dared to dream of. This is the powerful promise of stem cell therapy. But behind this curtain of hope and high-pressure sales, there's a story the clinics aren't telling, a story of surprising, unadvertised, and sometimes dangerous side effects. All over the world, a growing number of families are turning to private clinics that offer stem cell treatments for autism. They're often fueled by desperation and moved by compelling testimonials, seeing a beacon of hope where other therapies might have fallen short. The marketing is slick, suggesting it can reduce inflammation, repair the brain, and even reverse the core symptoms of autism. But what does the science actually say? As of 2025, stem cell therapy for autism is not approved by the FDA or other major regulatory bodies. It's still considered experimental, and with any experiment, there are risks. Today, we're cutting through the noise, looking at the evidence, and revealing the side effects these clinics often forget to mention. The science versus the sales pitch. Let's be clear, the idea of using stem cells to repair the body is genuinely revolutionary. In some areas of medicine, they have proven life-saving benefits. But when it comes to autism, the scientific community is hitting the brakes. The studies that clinics love to point to are usually small. They lack proper control groups, and honestly, they just aren't conclusive. The administration hasn't approved stem cell therapy for autism for one simple reason. There isn't enough good evidence to prove it's safe or effective. In fact, the FDA has put out warnings about clinics making these exact kinds of misleading claims. So, why is it being sold like a breakthrough? Many of these clinics operate in a sort of regulatory gray area, often outside of the United States, pushing emotional success stories instead of peer-reviewed science. And those stories are powerful, but they are not proof. The biggest risk here isn't just that it might not work, but that it could actually cause harm. The unadvertised side effects. While some clinics might claim their procedures are perfectly safe, the data from clinical trials and patient reports tells a very different story. Common side effects. The most common side effects are what you might call mild, and they happen in about 10 to 30% of cases. We're talking about things like fever, headaches, chills, and nausea. They're often temporary, but they're a clear sign that the body is reacting to having foreign cells introduced. Serious complications. But the risks don't stop there. More serious complications, while rarer, are a huge concern. Invasive injections, especially the ones that go into the spine, carry a real risk of serious infection. There have been documented cases where patients ended up in the hospital with severe bacterial infections because of contaminated stem cell products. And then there's the most alarming risk of all, the potential for tumors. While no cases have been directly reported in autism studies so far, it is a known theoretical risk with some types of stem cells. The European Medicines Agency has warned that unproven cell therapies have led to tumor formation in patients. Other serious side effects that have been reported from unapproved stem cell treatments include blood clots, the body's own immune system rejecting the cells, and even seizures. These aren't just far-fetched possibilities. They are real-world consequences that can have devastating, lifelong impacts. The power of hope and misinformation. If the science is shaky and the risks are real, why are so many people still choosing this path? The answer, as you can imagine, is complicated. Parents are driven by a powerful desire to help their children, and the marketing for these treatments is practically designed to prey on that hope. Clinic websites are filled with glowing testimonials and videos of children who seem to show incredible improvement. These stories create a narrative that is so emotionally compelling, it can easily overshadow the fact that there's no solid scientific evidence. Clinics might throw around oversimplified science, promising a miracle that will replace the hard work of therapies that are actually proven to work. This puts parents in a terrible position. Do they trust the slow, careful, and cautious scientific community, or do they believe the confident promises of a quick fix? The tragedy is that making that choice can cost them their life savings and, in the worst-case scenario, their child's health. We know this is a really sensitive and personal topic. If you or someone you know has had any experience with unproven treatments for autism, we hope you'll consider sharing your story in the comments. Your experience could be the very thing that helps someone else navigate these incredibly tough decisions. And if you believe in science-backed content that holds these claims up to the light, please subscribe and hit that notification bell. The desire for a cure for autism is totally understandable, but that deep desire also makes families vulnerable to those who would exploit it. As it stands, the overwhelming scientific and medical consensus is that stem cell therapy for autism is an unproven treatment with some very significant potential risks. The real hope isn't in expensive, unregulated therapies. It's in rigorous, careful scientific research and in the proven, evidence-based interventions that we know can support autistic individuals and help them thrive. Making informed decisions based on science instead of speculation is the best way we have to protect the people we love.